Yesterday we saw till this ribcage structure. There we saw that ribcage was having 1 to 7. First ribcage sternum, first rib which joins with the sternum till 7. It is called a true rib. Next 8, 9, 10 is called false, and the last two are floating. So up to this we saw. So today we will go into spinal curvature. So here there are 4 things to be noted in the spine. 4 types of curvatures are there. One near the cervical region, neck region, thoracic behind the chest, then lumbar in the lower back, sacral is near the tailbone. Okay, 4 things are there. So the first one is cervical curvature. Here there is an inward curve that will support the head and allow the neck to move freely. Then you have thoracic curvature, the outward curve that accommodates the rib cage and protects the vital organ. Since it is outward curved, the movement of the muscle along with the bone enhances the lungs movement also. Then the lumbar curvature, again it is inward and it bears the weight of the body and enables the trunk to become flexible. Then sacral curvature, it has the outward curve and that stabilizes the pelvis and support the spine base. So this is known as the S-shaped curve, which is natural and it has to be in the vertical side. Okay. Now there is a abnormal C-shape or S-shaped curve which is on the lateral side, which becomes the abnormal thing. Okay, that is called scoliosis, and this is abnormal and it happens in the adolescence when the child is growing. During the adolescent stage, this will come for certain kids, and that has to be rectified immediately. Otherwise, the whole stability of the body will get a hampered thing. Then this is just for the further explanation. I have given this slide here. So the curve direction is inward. Inward means we call it as lordosis. Outward is kyphosis. Then spine area, where this lordosis is seen, it is in the lower back and in the neck. And the outward curve is seen in the thoracic region. So how it is visibly seen? There is a sway back, prominent stomach or buttocks in the region. That region you can see. Then if there is a hunchback rounded thing, then it becomes an abnormal thing. Okay, then why do we have to have a good posture? So if a person stands like this, then he is said to be having a good posture. Otherwise, there is a forward bending of the head. Then there is a hunchback, or this lumbar lordosis can be seen in mostly who do this Bharatanatyam. No, they do this Aramandi, they sit and dance, so they can have possible. So there you have lumbar lordosis, and certain people can walk like this. So all these 4 are not good one. The first one is very good. So why is that? Posture is very important because it will enhance breathing efficiency. So proper alignment of the spine and the rib cage allows the diaphragm to move freely. As I already told you, the curvature of the spine is very essential, and when the curvature is right, the posture automatically becomes good. When that is happening, the diaphragm and the movement of the ribs will be very easy and it will become flexible, and the lung capacity will also improve. Then boosts your mental clarity and mood. Upright posture is linked to increased alertness. It will reduce the tiredness, even improve the self-esteem. So mostly the models, if you see, they will train them to have a good posture and walk accordingly also. They will always have the upright position only. Then it will prevent musculoskeletal strain. So mostly who are all sitting for a long time, they will have a hunchback, pot belly, all these things happen, and they will have a very much strain on their muscles, skeleton, also the internal organs. Okay. Then if there is a good posture, Then it will distribute the body weight evenly. It will reduce the stress on joints, ligaments, and muscles. Then it supports the core stability and balance. This spine will engage in the core muscles, mainly in the abdominal muscles, enhancing balance, coordination, and overall body awareness. Then it aids in digestion and circulation. This you might be knowing or experienced. When you sit straight and eat, the way the body receives the food will be different. When you have observed, when you have this couch thing and if you eat, there is a difference between the two. If you have a good posture and eat, the way of receiving food by the body is different from the way you sit with a hunchback and eat, because there is a compression in the abdominal organ. The stomach also will get compressed, and so the receiving of the food by the body and the metabolism itself will become very difficult, and it will be different also. Then it reflects confidence and presence. Posture influences how others perceive us and how we feel about ourselves. Then this is a conclusion slide. Overall skeletal functions. The first one, it supports posture and body shape. It stabilizes and secures the internal organs. This is just for a recap only. I'm telling all these things again. Then protection, cranium protects brain, eyes, and all other internal soft tissues. Then rib shield, heart and lungs. Vertebral safeguards the spinal cord. Then the movement bone serves as a lever for muscle action. Tendons connect muscle to bone, enabling the motion. Then we have blood cell production. So bone is having a red marrow cell which will produce red and white blood cells and platelets. Then mineral storage. Bone acts as a reservoir for essential minerals, and especially calcium and phosphorus are stored there. Yellow marrow of the bone will store fat. Then endocrine regulation. And recent research development shows that bone is also having an endocrine function, and it contributes to blood sugar control. So this is where you see the red marrow, and inside the red marrow you will have yellow marrow also, okay, in the picture. Then what is this? So the skeletal system is far more than a rigid scaffold. It's a dynamic and living network. It provides structure, protection, movement, while also playing key roles in blood cell formation, mineral balance, and endocrine regulation. Then from the tiniest ossicle in the ear to the mighty femur, each bone contributes to the harmony of human body. Then understanding the skeletal system deepens our appreciation of how form and function unite to support life. This form and function also there in yoga asanas, which you have to know. So when you bend forward, what happens? When you extend or when you go up, what happens? All these things comes under form and function of asana, which is majorly related to skeletal and muscular system. Then bones speak not in words, but in posture, resilience, and silent strength. So this is about skeletal system. Now about the muscle contraction. We have not yet completed the muscular skeletal system as such. Okay, now how the muscle is going to contract and enhance the movement we are going to see. There are three types of muscular contraction. So the first one is isotonic concentric. Next one is isotonic eccentric. Okay, then you have isometric contraction. So this is the three type of muscular contraction. So this is to show you how exactly that happens. It is isotonic contraction is moving towards the body. Eccentric is moving away from the body. Isometric is just holding. Okay, so all these things comes with the weight bearing things. When you lift the weight, it is isotonic concentric. When you are going to drop the weight, it is isotonic eccentric. Isometric is you are holding the weight. Against the gravity, whatever you do, that becomes isometric contraction. Now we will see a little elaborate way. So isotonic contraction, it produces tension in the muscles. where there is change in the muscle length. So this is very important point to be noted. When there is isotonic contraction, the muscle length is changing. Then it is a dynamic way of moving the joints, then resulting in moving a constant load through a range of motion. Then this is the difference between isotonic concentric contraction and the eccentric contraction. So here the definition, muscle shortens while generating a force. Eccentric, it is lengthening. That is why I told you when you lift the weight, it becomes concentric. Even now you can try and see, just have your arms straight, fold, have a fist in your arms, then you straighten your arm, you just do this and this. That is, you will fold your elbow and then you will release your elbow. When you see that, when the arm comes towards the body, it becomes concentric. When it moves away from the body, it becomes eccentric. Then effect on the muscle, it shortens the muscle fiber. Eccentric elongates the muscle fiber. Then joint movement, it will produce joint movement. Eccentric, it will control the joint movement. Then example I have already told you. Benefit, improves the flexibility and range of movement. Here it gives stability. So example in yoga asana, Uttanasana, when you do the forward bend, you see concentric in spinal flexors in your vertebral region. The muscles will have concentric effect in the spinal flexors region and eccentric in hamstrings. It is in the leg. And then in eccentric, where you see the same thing in hamstrings as dorsal-lowers, and concentric in abdominal region. Then you have this isometric, where you are going to hold the weight in your arms. So there is no change in the muscle length. That is very important point to be noted. Example, you are holding a weight without moving the arm. Then nature, it is static. Concentric, we saw it is dynamic. So metric, it is static in nature. There is no joint movement. So example, if you lean on the wall and if you are going to do this Utkatasana or Ardha Utkatasana, leaning on the wall, that is called wall sit. Okay, or plank hold. This is like your Chaturanga Dandasana. So all these things if you do, that is an example for isometric muscle contraction. Then there are two types in this, yielding and overcoming. Yielding is when you resist, that is your holding, grip hold. Okay, overcoming is you are going to push the wall or push something which is stationary. Okay, then effect on joints, it will stop the movement. So where can it be used in the yoga thing is, you will do it in the stay postures like Virabhadrasana, sorry, what is that, Uttanasanam, I'm sorry, Tadasanam, and then we have this Vrikshasanam, right? Tree pose. All these things are example for isometric muscle contraction. Then benefits, you have, it will help in strengthening and then increase the muscle tone and it gives postural stability. Then you have this postural roll where it is used in upright posture resisting the gravity. Then why is this very important? The health of the musculoskeletal is crucial for overall well-being throughout the life. With aging, bones become thinner and weaker. The muscles degenerate, reducing strength and function. Then cartilage and joint structures also deteriorate, leading to common issues like joint pain and stiffness. However, these age-related changes can be prevented or significantly delayed through the proper yogic practice. So, this proper yogic practice, in the sense, it is not like you are going to learn from anything and everything that is coming in the YouTube channel, or you buy a book and then you do your asanas. You will read it from the book and do your asanas. All these things are not good. You will have to rely on a authentic yoga teachers or authentic tradition where they don't deviate from their traditional teaching. So it is better to go to those kind of places and learn the yoga properly under a teacher's guidance. Then regular exercise and yogic practice help keep bones and muscles supporting structure strong throughout the life. This will enhance blood flow, oxygen supply, and nutrient delivery to all tissues. This enhanced circulation delays age-related degeneration, maintains functional capacity well into older age, and supporting independence and quality of life. So you can also see few examples of older people who are still very good, and if you ask, they might be having a simple yoga practices from their earlier age. From very beginning, they would have been doing at least like we call it Topukaranam, no? At least that they will do. Minimum, I am telling. In yogic terms, it is Utkatasana. So some simple yoga asanas, then pranayama, they might be doing so that they will have a healthy body even in their older age. Now, bone health and hormones. Yoga helps maintain bone mass and strength throughout the weight-bearing postures and mindful movement. So, what are all the weight-bearing poses? Example, even the simplest walking is a weight-bearing because it is acting against the gravity. And then you have the squats, planks, chair pose, Utkatasana, then Tadasana. All these things are examples. So this activities load your bone, which is crucial for preventing osteoporosis and can range from low impact, fast walking to high impact jogging or jumping, all these things. Then regular practice stimulates bone formation and helps prevent osteoporosis. Then combined with proper nutrition, vitamin D exposure, hormonal balance, yoga will create an optimum environment for lifelong bone health. Now, we use our body every day, but we are not charging it. We use our phone, we charge it every day, but our body we are not doing. What we have to do every day is simple yoga asanas. So simple exercises helps us recharge every day, keeping bone, joints, muscles and blood vessels healthy. Okay. Then what is the simple yoga practices for the beginners or the older adults? When you're going to teach, you have to start with gentle movements that will build strength and flexibility. Very gentle movements you will start with. So toe standing stretches improves flexibility and circulation from feet to neck. A simple yet powerful practice. But before this, you are learning this Pavana Muktasana series 1, right? You have all kinds of rotations in the joints. So that is the best one to enhance the muscles and the skeletal system. So it is better whomever you are going to teach, you start with Pavana Muktasana series. It is not for beginners, not for old people alone. If you are going to start to teach them with Pavana Muktasana series 1. Let them get the flexibility. Let them get the freeness in their joint. Later on, you can go and teach them simple asanas in a dynamic way. Then you go into static asanas. Okay? Slowly, gradually, you take them. Then awareness is very important. Keep eyes open to avoid imbalance. Focus on the breath and body sensation. This is very important if you are going to teach them a standing asana. Whatever comes under standing, you ask them to open their eyes and do. In lying or kneeling or seated, they can close their eyes. But in standing, compulsorily, you ask them to open the eyes and do their asanas so that they will not fall off. Then give them only safe postures. And here in the safe postures, if you have any, if you see them, you are going to give Vrikshasanam or Tadasanam. And if you see them, getting off their balance, you just try to modify the asana. Make it very simple. but the function of the asana must not change. This form, function, everything will be taken later by Balamurali sir, I think, in your course planning in the advanced steps. So when you go through the course, you will be knowing what all you can do. I am just giving you the words as an introduction. Okay. Then combine stretching, breath awareness, mindfulness for maximum benefit. Then each pose briefly, hold each pose briefly and rest between repetitions, allowing the body to integrate the practice. So these things, holding a pose, then how many times you have to give a single pose, then where you have to integrate the rest, and what is the counter pose. All these things will be taught in the forthcoming classes, not in anatomy, but you have a separate subject for that. So in that it will be dealt. Now precautions. What you have to do, avoid forward bend for back pain or disc issue. Also avoid intense poses while in any sort of pain and menstruation. This is very important. People will be very enthusiastic to do all kind of asanas. They will even ask you, they will even tempt you to teach them more, even though if they are in pain. But you have to make them understand during pain, you will do only minimal, slow moving asanas. They will not do any dynamic one. Okay. Then start with gentle leg stretches, ankle rotation, anti-rheumatoid exercises. That is what I told you. Bhavana Muktasana series 1 is the best one to start with. Then gradually increase the practice frequency. Never rush, especially for conditions like varicose vein. Then listen to your body, respects its current limitation, and then you will move forward. This is also important. Here, what they say is, there will be people who will come to you. They might be doing your Surya Namaskar or very intense asanas some 10 years back. Then in the meantime of 10 years, they would not have practiced at all. They'll be willing to renew their yogic practice. At that time, they will come and tell you, I have been doing Surya Namaskar early. I will start with that. To them, you will tell, it is not right to start with Surya Namaskar and intense practice immediately. Just go step by step from the basic thing, and then we'll move on into the other intense postures later. Because 10 years is a very long gap. Their body can have different, their composition would have been changed by this 10 years. So you will have to bring them back to the older mode. Only then you have to teach them the intense practices, okay? Now muscle strengthening. Muscles are made up of millions of cells that need oxygen and nutrients to function properly. Each cell is a living unit requiring constant nourishment. Then yoga stretches improve blood supply, remove metabolic waste, and maintain muscle strength. So this yoga stretches, this third point, no, if you are doing yoga every day, before the asana practice and after the asana practice, this is the way to check your quality of doing asana. Before asana, what is the state of your body? After asana, how do you feel? If you feel relaxed, you have a subtle or a rhythmic heart rate, your breath must be subtle, and your body must be energized. If all these things are there, then the practice what you have done is a good one, good quality one. If there is a change in the breathing pattern or in your heart rate, or if you are feeling tired, then the way you have practiced that day asana is not correct. This is how you are going to check your own practices. Okay? Strong muscles support joints, reducing pain and improving mobility throughout the body. This is the importance of having a good muscular system. Then managing common muscular skeletal issues. Conditions like back pain, cervical pain, knee, osteoporosis, rheumatoid arthritis can effectively be managed with consistent practice. Simple yogic practices are very important to be done every day by everybody. Tadasnam, Kati Chakrasnam, Vajrasnam, all these things are examples. Then the second one, gentle stretches. So this will improve circulation and flexibility. And then breathing exercises, that is pranayama, enhances oxygen delivery and promote relaxation throughout the body. Then yoga helps delay degeneration, strengthen supporting structures and reduce discomfort. So, okay, today's class is only for this much. If you have any doubts, you can ask me related to what all we have seen so far. We will move on to the next system later. Yes. If you are not going to ask me any doubt, then I will ask you to do some physical activity as games. Then you will know how your muscular skeletal system is. Whether it is very active, strong. You can experiment on yourself. Yes? Or can we start with the next system also? What do you feel?
We can start, ma'am.
Okay, we'll move on to the next one then.
Some muscular activities we can do.
Oh, that also we'll do? Okay, fine.
Yeah, that is fine.
Okay. Instead of making it so boring, no, we'll do something.
Yeah.
Yeah, good. Okay. So, okay, we will coordinate your brain and your activity. Okay. So, what is the rules is or steps what you are going to do? If I say clap, everybody please clap. I don't want you to do namaskaram. I want you to clap. Very good. Okay, this is clapping, right? Now, what is namaskaram? How do you know namaskaram? Now, I want you to do it. Raise your arms from the sides, take it to the top of your head, do namaskaram there and bring it down. Okay, this is the second one. Then third one is, what is snapping? Snapping. Okay, good. This is snapping. Then, what is winking? Yes, one eye? Single eye? Yeah, good. So, four things are there. Now, what I'm going to do is, when I tell you to clap your hands, you will have to raise your arms from the sides, take it to the top, do the namaskaram and bring it down. This is for clapping. For namaskaram, if I say, you will do clapping. Okay, for snapping, you will do winking. One eye winking, not two eyes. Okay, then for snapping, you do winking. For winking, you do snapping. Now, just we will have a rehearsal like, then we'll move on into the main thing. Okay. So now, snap. Forgot what to do. No, snap, you have to do winking, right? Yes, Simrat ma'am. Not okay. See, this is why I give you rehearsal. Otherwise, you will miss it. Okay, now, namaskaram. Oh, this is good. Selvaraj sir, namaskaram na kaitatnu. Ayo sir, you are in mute. No. I don't think you have got the rules correct. For namaskaram, you will do clapping. For clapping, you will do namaskaram. For snapping, you do winking. For winking, you do snapping.
Can I add something, madam?
Yeah, please.
Can I add something?
Yeah, please.
What we used to do is Sanskaram, Anya, Duriam.
Yeah, that is correct. But this is a game, no?
No, this is the way normally we used to do this.
Yeah, no, this is a game. I want you to coordinate your mind activity along with your physical movement. Okay, we will go into the game now. Okay, first I will do it very slow, then I will make it fast. How far your coordination is, we will see. Good? Okay, now winking, snapping. Very good. Namaskaram. Clapping, clapping. Got it. Okay, winking, snapping, clapping, winking, snap, clap, clap, wink, snap, wink, snap, snap. Kritika ma'am, I told you when you do snapping, you will do winking. You are doing snapping only.
Sorry, ma'am.
No, it's not for sorry. It's fun, no? It's nothing to say sorry and all. Okay, I don't know why Nisha Devi's ma'am's son is not participating in the game. He is a regular attendee, but he is not attending the games. Okay, so why this game is, you have the brain and the muscle coordination, which means the nerves and the muscles have to get coordination very well. But during the aging process, the coordination between the brain and the muscular system will not happen correctly. And this is why in the old age, most of the people will be having this Alzheimer's, dementia, all these things happens because there is no proper coordination between the brain and the muscular system. For this, what they are telling is, above 40, what is the best thing to do? You take a pencil or a pen and keep writing every day, or do drawing, sketching, something with your fingers. Fine motor skills are there. So fine motors is the fingers, whatever you do with the fingers is fine motor. So you take a pen or pencil and do keep writing something, whatever you like, or you see a book and then keep writing. All these things will enhance the muscular and the nervous system coordination, and there will be a very good what to say, a good connection between these two, and the dementia process will not happen in the brain. This is one thing, scientific way of seeing. What our traditions taught us from the ancient yogic or Vedic period, what they have taught us is, you know this Likita Japa? They keep writing Om Namah Shivaya or Jai Shri Ram. All these things they keep writing. How they will write is, they will take 3 or 4 color pens. Okay. Each line will have different colors. And they will write it very short, but very neatly. The words will be very legible, very neat, but it will be very small in size. Why this they have given is, and mostly if you see, it is not the youngsters who will do. Only those who are above 50, they will do. So in our tradition, they have not told the reason why you have to do. But the reason behind that is, our brain will be very youthful strength. It will have a good memory, and then the function of the brain will be very good. To maintain that, they have told all these things in the earlier region, but no people know the reason behind. So all these things are going down. Nobody is following. But this is very, very essential to keep your coordination of brain and muscles in a proper manner. Okay, so this is why I gave you that. There are so many games also related to this coordination. So when we move into our nervous system, I'll give you a few more games. Okay? Okay, so now, anything else you want to tell? Okay, we'll move on to the next one.
The tendons and ligaments in joints that knee, no? Nowadays we are having so much pain. In 40s or 30s itself, they are getting the knee pain. For that, how we suggest for the tendons and ligaments?
No, the thing
That
is
is
like,
pain is.
yes, morning, Gautami ma'am is taking this Pavana series 1, right?
Yeah, yeah.
So
Mm.
that is very important for everybody. That is why I started this game before telling all these things. I told you that rotation of every joint is very important. And when you coordinate with the breath, the effect will be more. So even if there is a problem with tendons or ligaments, cartilages, you can ask them to do it very slowly
Okay.
and gradually the pain will reduce. But more than that, you see if they are not having rheumatoid arthritis, then they can use oil. If they have arthritis, I mean like rheumatoid, then they cannot use oil. They can use what is that liniment they say. It is not an oil. It is not an ointment. In between, you have a liquid, so that they
Liquid.
can use for relieving the pain. And then they
Mm.
can reduce the pain, do this very slowly. They can even lie on the bed and do all these asanas. I think Gautami ma'am would have told you, even the patients who cannot sit and do, they can lie down and do these, the Pavana Muktasana series 1. Though not all 17 or 18, at least the basic movements like in ankle rotation, knee pulling and releasing, all these things, even on the bed they can do. That will relieve the pain in the joints. Yes.
Yeah.
But if
This.
there is a severe thing, then they have to consult the doctor only.
Okay. Then for frozen shoulder, how we can treat that one?
Frozen shoulders, only what to say, initially you have to go for physiotherapy because they will give you this IFT treatment, right? So first they will give that, you have to reduce the pain and only then move into asanas. And main thing, whoever comes to you, if they have pain, ask them not to do anything, consult a doctor, reduce the pain, then you come back. That is the best thing what we can do.
By
Mm.
Because
doing
we are not
physiotherapy,
doctors.
madam, by doing physiotherapy, we get cured, madam. That is a personal experience.
Yes, sir. After cure, to maintain, you can do yoga, I'm telling.
Now I am doing it. In fact, I did only for 10 days. Then I
Oh,
got cured.
yes. Physiotherapy has its own benefits and
Because we do exercise every day, so,
yes.
so that within a few days we got cured.
Good, sir. Yes. So to
Some
maintain and not to get the pain again, you have to do yoga, I'm telling.
some people going for that aerobic and gym and no, they're coming for that frozen shoulder and that is tendons and muscles pains. After that, they came to us.
Yeah,
What
it
to do
happens.
for like that? That's
It
why. And
happens.
the small children also, they are not having the balance in the legs. Even though they are not doing that in Tadasana, they
Ah,
can't balance in the toes.
yes. Ask them to keep their legs apart, start doing
Yeah,
like that. Then they can keep their legs together and then do. Let them get stability, then slowly let them keep together and then do. Before that, to gain stability, it is better to have their legs apart, at least shoulder width distance. They
yeah.
will keep their feet and then do Tadasana.
Like that only we trained that.
Very good.
That
That is
is the problem. This.
yes.
Also, breathing. Also, nowadays after the COVID, almost 70 to 80% of the persons having the opposite breathing system. That is,
Yes.
when they inhale, the abdomen goes inside. Like that, they are having the problem. Even the small children also, the position is the opposite.
Yes, for them, that is why in the
That's
beginning of the class, in the
first
first
itself we are
class,
correcting that.
yes, first class itself, I told you, whoever comes to you, first ask them to sit
Yeah,
or lie down, then check their breathing pattern if it is
yeah,
correct or it is reversed. If it is reversed, then you have to teach them how to do correct or proper breathing,
yeah,
and only then you will move into
yeah,
the
yeah.
next thing. Yes, Shilpika ma'am,
Ma'am,
mute, you are in mute.
I ask on doubt.
Yeah, 1 minute. Let Shilpika ma'am say.
I was
Then I'll
asking
come.
if we can.
No, again it went to mute.
Unmute your mic.
I was asking if knitting or doing crochet is a fine motor skill.
No, I couldn't understand what was your question. What is it?
Am I audible?
Yeah, you're audible, but the words are not clear. Can you please repeat the question?
I was asking if knitting or doing crochet is a fine motor skill.
Yes, that also you can do. If you know that, you can do that.
Yeah.
But mostly they don't know. No, writing is common for everybody. Anybody can do that. But these things only who are trained can do.
Yeah.
Since it's creative, it makes us feel good if we are creating something.
Yes,
For
exactly.
ladies, we can suggest that, but men's the
No,
writing will be
ladies you
problem.
can suggest only then only when they
They
know.
no practiced, yeah.
If they don't know, if you suggest also, it makes no difference. They are not going to follow. If you say writing, drawing, painting, all these things they will do, right?
Yes.
Kritika ma'am?
In the small children also have the sound in knees. When will be sit and stand, the sound will become.
So that
Like
is
what
because
will
of the
happen?
food they eat. They don't have strength in their knees. The food is not proper. They take too much of junk foods. So snacks are there. Packaged foods they take. So all these things are the reason. So first you have to ask their parents to change their food pattern. Then
Okay, ma'am.
if it is severe, they have to check with the doctor, or this joint movement exercises will, asanas will be very good for them also.
Okay,
Okay.
ma'am.
Okay. We have 15 more minutes. I think I'll move on to the next thing.
Ma'am, one more question, ma'am.
Yes,
When
please.
we do that wrong breathing, no, ma'am, that
Okay.
is, what will be the effect on them, ma'am?
Anxiety will be there because
Okay.
wrong breathing, in the sense most of the chest expansion only happens, correct? So
Yes.
obviously when you are anxious, naturally the body will try to take more air and it will have a shallow breathing. It will not go till the end. It will stop
Okay.
only with the upper or the middle chest region. So
Mm.
this will naturally happens when there is anxiety. But if your breathing itself is going to happen that way, then the anxiety will not go at all.
Okay. Okay.
Also, it
Anxiety will be
slows
there.
the metabolism, no, ma'am.
It
And
slows.
because of the carbon dioxide, we are not exhaling properly. So,
Yes.
so that it can affect lungs also in future.
No, it can affect on all.
Oh.
Total, everything it will have an effect, because mainly anxiety deals with the brain and there the function will be more, then everything will have a haphazard way of thing.
Okay.
Okay, so
Okay. Thank you, ma'am.
okay. So now we will see the urinary system, which is very, very vital and which is very important. So first we saw skeletal and muscular system. So that is because we are going to stand, we are going to move, we are going to do all activities. Okay, so that is the first system what we have to know, and most of the asanas are in a dynamic way. For that dynamics to happen, we have to know the basics of skeletal and muscular system.
Ma'am, one more question I have.
Okay, yeah.
What are the muscular skeletals disorders may become?
No, disorders we are not teaching here. This is basic anatomy only. So
No,
disorders are
okay,
not
but
going.
what are the disorders? If you can name it,
See,
name.
disorders can be many things. Even a basic pain due to overstraining of the knees also comes under disorder only. So we don't have to go into that. We are just
Okay.
dealing with anatomy. We will move on
Okay.
with this one.
Okay.
So the next one, why did I choose this urinary system, is when you do asanas, naturally there will be a removal of waste in some form. Okay, mainly it enhances the urinary system. So we will move on with this system next. So this is very essential. Then the next one. Okay, so urinary system is far more than just a mechanism for producing and eliminating the urine. Now it is fundamental for maintaining the homeostasis. So this word I am bringing in now. Why? Because this urinary system is the first one where this homeostasis is being maintained. What is this is your internal environment, that is your temperature, your blood pressure, glucose, everything has to be in a normal condition for normal functioning of the body. So for that, the urinary system must be very good and it will help in maintaining this balance in your internal conditions or environment. And then now what this urinary system will do, it will help in maintaining the water and blood balance. What does it does? The amount, the chemical composition, acidity, all these things are maintained by diffusion and active transport of materials. Now electrolyte control, the mineral balance, that is calcium, phosphorus, all these things are balanced because of this urinary system only. Then waste removal, what are all excess in the blood, it will remove. What is not required for the body, it will remove. So not necessary that it is only the waste or the toxic substances are removed. Even if the micronutrients or macronutrients, if they are in excess condition, that is also removed by or removed through the urine. Okay. Then it will control the blood pressure. Then RBC production is also being maintained because of this. Then vitamin D activation, because calcium absorption is done due to this urinary system functioning. Now, the location of kidney in the human body. So, location is below the rib cage on both sides of the spine. So, if you have noticed someone who is having this kidney stone or something like that, the pain will be in the upper back, either on the left side or right side, wherever it is placed, the pain will be there. So only then we will find out that it is because of some wrong thing in the kidney, the pain is coming in the lower, the upper back. Okay, now the area is upper and middle back lumbar region. Position is, they are situated behind the abdominal lining. That is, the abdomen is there. You have abdominal organs. So behind that, there will be this kidney presence. Then the right kidney is slightly lower than the left one because of the presence of the liver. So liver is there. To position the liver, the right kidney is slightly lower than the left one. Then the size of the kidney is smaller than the closed fist. So if you close your hand like this, the kidney will be smaller than this. To whoever, for you, it will be smaller than your own fist. Okay. Now, components of urinary system. So it has two kidneys, one on the right, one on the left. Then two ureters. It is starting from the kidney and it will end in the urinary bladder. From each side you have one ureter. And then muscular sac. That muscular sac is your urinary bladder where the urine is getting stored, approximately 600 ml. Then urethra is the tube through which the urine comes out of the body. Now these are all the kidney parts. Here what I wanted to tell you is these parts I will just read and I will show you in the picture. You need not remember everything. This is just for you to know. One thing is what you have to remember or it will be beneficial for you is if the word renal comes somewhere, when you come across the word renal, you must know it is related with kidney. Okay. If there is a word neural, neural comes, you must know it is related with the nervous system. So these are the words, if you know, that is enough. Auditory means hearing. Olfactory means something related with smell. So these things, these keywords, if you know, that is enough. These, what I am going to tell you now is just for your hearing. Now you just hear. If you can remember, it is well and good. Otherwise, this you have to know. I am telling you. That's all. Okay. Need not by heart. You need not think more about this. Then the cortex is the outer layer of the kidney. So kidney is having two layers. One, the cortex, that is the outer one. Outer layer where the blood is first filtered. So each and every layer of the kidney is doing its own function in removing the waste or the excess material from the blood, and it converts it into the urine. Then medulla, the inner region that contains renal pyramid. So here you see certain things, right? Like brushes you have in the kidney, they are all renal pyramids. Then where urine is collected and concentrated and drained towards the calcaris. Then nephron, the tiny working unit. And in the kidney, this nephron is a very, very important cell. This is the one where exactly the urine is being produced. From the blood, the nephron is the place where urine is removed or it is being produced. Then renal pelvis, it is a funnel-like space that collects the urine from the ducts. So you have this region, no? From here the urine will be produced and it is coming here. After that it goes into the ureter. Then renal column is the whole region here. It anchors the cortex to the medulla. So it is connecting the medulla and the cortex. So that is called renal column. Then renal pyramid is the cone-shaped structure that is present in the medulla where the urine formation happens and it drains into the calcae. Then ureter is the tube which is going to collect the urine and pass it on to the urinary bladder. Now, the basic unit of kidney function, it has 1 million nephron. So, nephron is this one, what is shown here. This is one single cell where like this you have millions of cells in the kidneys, and because of that, the working of kidney is happening. So, it filters the blood and forms the urine. So, glomerulus is this portion. What it will do is, it will filter the salt waste from the blood. It will block the blood cells and large molecules. So this is what is very important. If you have any infection or if there are any critical conditions like cancer or something else, this functioning of glomerulus will not happen properly, and that is why people may urinate blood along with the urine. During infections like E. coli infection, there will be no pain, but the blood color, the urine color will change. There can be blood oozing out along with the urine. Simple E. coli, that will create many problems. So if that is happening, then the functioning of this is not happening properly. That is what we have to understand. Then Bowman capsule, it is a cup-like structure around the glomerulus. It collects the filtered fluid and it is found in the cortex. Then loop of Henle, here you see this one. So it is a U-shaped tube that concentrates urine by reabsorbing water and salt. So here the reabsorption happens. This is where next important thing. Even though in the first place the blood is being purified, urine is being collected, from that urine also the reabsorption of minerals is happening. The second filtered one only is coming out. Okay, so useful substances like glucose, amino acids are reabsorbed, excess ions and waste are secreted into the urine. Then collecting duct, a tube that gathers urine from many nephrons and send it to the renal pelvis, and it runs through the medulla. Then you have a short difference between female and male urinary system. So female will have a short urethra. It is separate from the reproductive tract. But the male will have a long urethra. It is shared with the reproductive system. So the same urethra is the one which is going to eliminate urine during the excretion process, and it is the one which is going to give the seminal fluid along with the sperm during the copulation. Now, why do we have to drink water? 1 minute. Okay, we have time. So, why is that we have to drink water? It is said like a normal person have to drink 8 tumbler or 8 glasses of water. That is equal or approximately equal to 1.5 to 2 liters of water minimum. And it depends upon the person. Even if he wants, he can drink 2.5 liters also in a day. But minimum, it is recommended 1.5 to 2 liters of water. So why is that important? So first one, to keep our body hydrated. Why our body must be hydrated? Because our body is approximately made up of 70 to 72% of water. And if the blood has to circulate properly, if the viscosity of the blood has to be maintained, then drinking water is very essential. You can also keep an alarm and drink water. Each every 1 hour, 1.5 hour, you can take a glass of water and then have it. Then brain's gray matter is 85% of water. Fat cells are 15% of water. Here I have an interesting fact to tell you something. In our olden days or in our tradition, whoever comes inside our home as a guest, or if we are going outside and coming in, what is the first thing we will do to them, to our guest? Any idea? Any suggestions? If a guest comes to our home, what is that thing we are going to do in the first
We are
thing?
giving the water to them.
Water.
Why?
That is the tradition, we think so.
That is what tradition, but there must be a reason behind that, right?
Maybe they're coming from long way, so they have thirst. Maybe they, so that we are giving that water.
See,
It may help to them.
water, even if a person who is in anger and if they are going to come to your home to fight with you, if you give them water, their anger and their anxiety will reduce to 50%. What to say, the strength of their anger will get reduced, so the amount of scolding will also get reduced. So,
Madam, if a person comes with anger, he will not touch the water. He will only fight with us.
no, you have to coax him to drink water. That is in your hands. So you can tell them like you're angry now, so please sit down, cool yourself, have some water, then we will talk. Then he will sit down, drink water, then talking will happen, scolding will not happen. So why? Because see, brain's gray matter is 85% of water, your body is having 70% of water. When they are angry, the circulation will be more, the naturally sweating will be more, the body heat will be more. When they drink water, all three things will get reduced. Naturally, their mind also will become calm. So this is why in our tradition, they say whoever comes, even if they are not angry also, we give them water so that let them cool down and have a good talk with us. Okay, now daily intake 1.5 to 3.5 liters of water. It can go in the form of food or drink, then varies with climate. And here water, in the sense it is not water, it is fluid intake also. So you can take it in the form of juices, buttermilk, etc. Or if you have some milkshakes or something, that also you can have. Then water balances, intake is equal to output. Then body eliminates as much as it consumes. So you have to drink water to compensate the loss by sweat and also for the urinary system functioning, proper functioning. Okay, I think now the time is up. We will continue this tomorrow. Yes? Any doubts you have?
Thank you.
முடிச்சிட்டு போங்கன்னு திட்டுறீங்களா சார்? Okay. Okay, sir. We will
My-
close it with
My regards to
prayer.
Balam Reddy, madam.
Yes, sir?
My regards to Balam Reddy.
Yes, sir. I'll tell him. Okay, we'll close with a prayer. Please sit erect in cross-leg posture. If you don't, if you are sitting in the chair, then have your right ankle on your left ankle, cross-leg posture. Keep your palms on the lap, palms facing upwards. If you are wearing specs, please remove, sit erect, close your eyes. We'll end with the prayer. करचरणकृतं वा कायजं कर्मजं वा श्रवणनयनजं वा मानसं वा परातं विहितं अविहितं वा सर्वमेतत् स्वमस्व जय जय करुणाब्धे जय जय करुणाब्धे ॐ श्री महादेव शम्भो and gently open your eyes. Okay, we will meet tomorrow. Hari Om. Thank you all. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Ma'am,
Yes, yes, yes.
ma'am, will this class be happen this time or in the morning? Anatomy.
No, only today it is this time. Anatomy will be in the morning only.
Okay.
Only today there is a change in the time.
Tomorrow it will be in the morning.
After asana. Yes.
Thank you. Thank you.
Thank you.